Hi.
Hi.
How are you?
Good, thank you.
My name is Anicia. I'm a student with West Texas A&M. Can you state your full name for me?
Yvonne Chase,
And date of birth.
July 30th, 1961.
And do you know where you are?
Yes.
Okay. Nice to meet you.
Nice to meet you too.
All right, so we're here for your annual physical assessment today. Excellent. Okay, so I'm actually going to be doing a complete just head to toe. Start at your scalp, end at your toes with maybe some walking just to
Okay.
assess your gait. At any point in time, if you're uncomfortable or something, is making you uncomfortable, you just let me know.
Okay.
Okay? So go ahead and actually I'm gonna go ahead and take a look at your skin here since your arms are out. Any sort of bruises, rashes, irritation, nothing.
No.
Let me see your fingers. Okay, nail polish. I'm just gonna check for your capillary refill, which is great. Less than a second. And your pulses, which are nice and strong. Okay. So I'm gonna take a look back here, just assessing your scalp for any sort of dryness, redness, irritation. Hair distribution is even. All right, excellent. Okay, and then I'm just gonna take a look inside your eyes.
Okay.
Let this dry a second. I'm just gonna pull down on your lower lid and just take a look inside your sclera. Okay, it's nice and white, and your conjunctiva is nice and pink. I'm actually first gonna just check for your pupillary reflexes, part of the cranial nerve. So I'm gonna dim one of the lights and get started with that. This goes into 0. Okay. Take a look here. Pupils react great. Okay, and then I'm just going to shine it in one more time. If you could just look straight forward like you were, that's great. Looking for, it's called a red reflex, and it looks like there's no sort of like opacities or anything blocking that right now. I'm going to turn the light back on. I'm going to go ahead and look for, along with the cranial nerves, for your extraocular movement. So if you could just follow my finger, just follow it with your eyes. You don't
Okay.
need to move your head or anything. So stare up. Excellent. There's a few of the cranial nerves in there, checking your pupils and then how well your eyes move around. I'm actually going to look for now peripheral vision. So I'm going to bring my hands up and you just let me know when you see them. I'll do one side at a time, okay?
Yeah.
Excellent.
Yeah.
Great. Okay. So next we'll check your hearing. So I'm going to go ahead and this is going to make a sound. You just let me know what it sounds like and then when you stop hearing it. Okay? So I'm going to move your hair right here.
No. Sounds like just like a ding, like a.
Okay. Do you still hear it?
No.
Okay. That's okay. I said it kind of confusing. So if it sounds like what it sounds like,
Just like a hum.
perfect.
Okay.
And then when you stop hearing it.
Okay. Gotcha. Okay. Let's stop.
Okay. And then I'm going to do something called the whisper test. So I'm going to whisper something in this ear
Okay.
and cover this ear, and you just let me know what you hear.
Okay.
Okay?
12.
Perfect. Same thing on this side.
13.
Okay. Awesome. And I'm actually going to do this one more time, and you just let me know if you hear it equally in your
Oh,
ears,
okay.
okay? Does it feel like you hear it on either side, one or?
No.
Okay, great. Go ahead and take a peek in your ears now. Hearing is great. Just gonna lift up gently and shine this light in there, okay? Looks great. Is there any dryness or irritation?
No.
Okay, they look like it's great in there. All right, great. So Hearing is good. Ears look good. Okay. Next, we're gonna I'm gonna have you smell something, and you just let me know. There's a scent here on this little cloth. You let me know what it smells like, and then we'll take a peek inside your nose as well. Okay.
Cinnamon.
Woohoo! That's exactly what it is. Hope you like cinnamon. It's around for all the holidays right now. So, any sort of exudate, discharge, irritation?
No.
Okay. Great. Awesome. Awesome. Okay. No sort of deviated septum or anything like that. Great. Okay, so a couple other of the facial nerves in there. I'm going to go out of order with some of them.
Okay.
But next we're going to do cranial nerve 5. So this actually has 2 parts. There's a sensory part and a motor part. So I'm going to do the sensory part first. Just let me know what this feels like on your face, okay?
Soft.
Okay.
Soft.
Feel it equally on both sides? Okay. And then I'm actually going to put my hands right here, and I'm going to have you pretend like you're chewing. Oh, awesome. Just making sure that they go up and down. All right, and then cranial nerve, actually, while we're here, cranial nerve 7, can you raise your eyebrows for me? I'm gonna lift this. Okay, and then can you puff out your cheeks? And then can you frown? Perfect. Just making sure that it's symmetrical on both sides.
Okay.
And then we're gonna take a peek inside your mouth. And we'll assess the cranial nerves associated with your mouth as well. So that's cranial nerve 9, 10, and 12. So what I'm just checking for is making sure that your uvula goes up and down and that your tongue can move side to side, okay? So I'm not gonna stick this too far in, just barely, and if you could just say ah.
Ah.
Very good. I'm actually gonna use the light because I couldn't see it too well. Okay, one more time. Very good. Okay. And then can you stick out your tongue for me and move it to the left, move it to the right? Okay, no issues with chewing or anything like that? Okay, perfect. So then next we're gonna go ahead and I'm gonna assess your thyroid, and then I'm gonna go for all the lymph nodes. Oh, one more cranial nerve, sorry. I'm actually gonna push down on your shoulders right here. Can you just resist my, awesome. That's cranial nerve 11. So we're gonna go into the neck, the lymph nodes, and see what's going on there, okay? I'm gonna come behind here. And if you could just pretend, swallow for me. Sorry, I should have provided you with some water, but awesome. And then one more time. Awesome. Okay, so I was just checking for your thyroid there. Okay, and then lymph nodes. There's a lot of them. I'm just going to name them as I go through, okay? And I'm just assessing for any enlargement or abnormalities. Okay, here is the pre-auricular, post-auricular, occipital, tonsillar, submandibular, segmental, superficial cervical, posterior cervical, deep cervical chain, supraclavicular. All right, great. No abnormalities there. I'm actually going to come around the back of you now. And I'm just going to assess your spine. I'm looking for any curvature or anything like that. Any issues with it? Any back pain that you know of?
No.
Okay. Awesome. Since I'm here, I'm going to actually percuss your posterior lungs and take a listen to your posterior lungs. I'm going to ask you to take a few deep breaths. I'll tell you when, okay? Go ahead. Awesome. Okay, since I'm back here, is it okay that I lift your shirt a little bit? I'm
Yes.
just gonna assess your kidneys. So, just gonna see if I'm looking for any sort of tenderness or rebound tenderness. So you just let me know if this is uncomfortable at all for you.
No.
Alright, okay. I'm gonna come forward. I'm actually gonna percuss and listen to your anterior chest. Take a listen now. Just to your lungs. You can just breathe normal for me. Lift your shirt and put this one deep breath for me. Awesome. And then on this side as well. Awesome. Okay. So next we're actually going to go ahead and start the cardiac assessment. But I'm going to have you lay down, move this out of the way. Is that okay?
Sure.
Okay. Lay down. Okay, actually, can you raise your arms for me for a second? I just want to go ahead and just going to assess here for your axillary lymph nodes. Okay. All right. Okay, so I'm going to start by listening for what's called a bruit in your carotid area here. My stethoscope. Okay, and then I'm just going to go through and identify some of the regions as I'm listening to your heart sounds, okay? This is the second intercostal space. I'm listening for the aortic sound. Okay, in the second intercostal space, I'm listening for the pulmonic. Okay, and inside here, I'm just going to stick this down. I'm not going to pull your shirt down. I'm listening for the tricuspid. Over here, I'm going to just stick my stethoscope under here to listen for the mitral valve. Okay, I'm going to flip my stethoscope and listen in 2 more spaces, okay? Okay, wonderful. Okay, since I'm here, I am going to go down to your abdomen. Okay, so I'm actually going to listen. I'm going to do it a little different than I list everywhere else was percussing and then listening. I'm going to listen and then I'm going to move around, okay? Just listening for active bowel sounds. Active bowel sounds in all 4 quadrants. I'm just going to go ahead and tap on you. Okay, and I'm just going to push down a little bit, okay?
Mm-hmm.
Any sort of discomfort. Excellent, okay. So I'm going to try to fill for your liver here, and then I'm going to try and fill for your spleen here. Okay, I'm just going to kind of lift up back here, and then I'm going to ask you to take a deep breath for me, okay? You can go ahead and let the breath out. Okay. Great, could feel just the edges of it a little bit. And on this side, same. I'm going to try and assess your spleen. Go ahead and take a deep breath for me. All right. Can't feel it really. All right. Any abdominal issues?
No.
Okay, go to the restroom fine, things like that. Okay, great. I'm gonna go ahead and have you sit up now. Actually, I'm gonna keep you here, sorry.
Okay.
Let's do I'm gonna check some of your musculoskeletal. So your hips and your feet. I'm gonna make sure that, okay, so I'm actually, if you can bring your knee like closer to your chest, bring it to your chest, and then can you rotate your hip out to me? Yeah, perfect. And then to the other side. We'll go ahead and do it this way and rotate it out. Awesome. Okay, I'm just gonna check your pulses down here on your feet. For the dorsalis pedis. It's a nice strong pulse here on your left foot. Nice strong pulse here on your right foot. Looking for the post-tibial. Nice strong pulse there. Nice strong pulse there. Okay, I'm gonna go ahead and bring you up. We're gonna sit up. All right, great. Okay, so a couple more things. Gonna check some of your reflexes. While you're here, your ankles, can you move those around okay? Feel okay? Any sort of, okay, no restrictions or anything. Okay, so I'm just gonna check this here. And then I'll do a couple other little sensory tests. So right here. Okay, and then on this side. Okay, perfect. I'll stay like that a second. So I just want you to let me know, like sensory, I'm gonna just touch you on your arms and your legs and you let me know if it is soft or hard.
Okay.
Or sharp, I guess would be better. Okay, so you can just close your eyes for me and just let me know what you feel.
Soft. Soft. It's like a poke.
Okay, good.
Poke. Soft. Soft. Poke. Soft. Poke. Soft.
Great. So next what we will do is we're just gonna assess your gait.
Okay.
Okay, so how do you feel with your strength? Like upper body, lower body, is one stronger than the other? Do you
No.
feel like it's equal?
I think it's pretty
Okay,
equal.
and then exercise. You try walking, jogging. Okay, walking is good. Keeps us strong, okay?
Do I need to put these in?
Oh,
you
yeah.
can have me walk?
Yeah, I'm just gonna have you do some walking. And I didn't ask you this earlier, but a lot of your, there's a lot of seasonal allergies. Do you have any sort of, because when I felt your face, your sinuses felt fine, but I just wanted to ask
No,
if there's
there's
any
none.
sort of tenderness in those areas. Okay. Okay, can you just go ahead and walk regular to the hand sanitizer for me? Great. Okay, and then I'm gonna go ahead and ask you to walk on your tippy toes towards me. Perfect, you feel balanced when you're doing that? Okay, and then when you walk back, can you walk on the heels of your feet for me? Okay, excellent. All right, well, that actually concludes our assessment. I saw that your vitals were taken, they're okay. You can go ahead and get dressed.
Okay.
Thank you so much.
Thank you very much.
All right.